ringing, fullness, dizziness. That's a topic for absolutely a total separate presentation of our series. But I won't keep you in suspense. That inflammation can get into the inner ear, and I can show you anatomically where. By the way, I mean, I don't know whether I mentioned it in the earlier part of the series, but when I finished dental school, I also finished with a master's degree in anatomy and cell biology. So by the time I finished my 4 years of dental school, I had a DDS and an MS in anatomy cell biology. So I do know a little bit about it, and I was able to use that information when I actually did my own research, trying to figure out why surgery wasn't the answer and why night guards weren't the answer and orthodontic treatment isn't the answer and a lot of things, drugs aren't the answer and Botox is not the answer, which we'll go into at great length later on. But I just wanted to get this across as clearly as I could and distinctly as I could at the early stages of this series to, quote, demystify temporomandibular joint problems. And then we'll talk at great length, I'm certain, about how the device that we developed works and why it works. But it's simple. It unloads the temporomandibular joint. If you had a bad knee, the orthopedic surgeon, if you didn't have anything else to do and didn't want to go into some surgical event, the first thing he'd do is put you on crutches. Why? To take the load off the knee. And if you take the load off the knee, the inflammation goes away and it feels better. So that's how we started out, and talking with patients. They gave me the key as to how to treat this thing. If I put my finger, my tongue, my pencil eraser between my front teeth, it feels better. And made a device that did that and unloaded the posterior teeth. 90% of the loads come from the posterior teeth on the temporomandibular joint, and that causes inflammation. And now you know how inflammation can cause the disparate symptoms.